Okay, hi everyone. I'm Lynette. I'm a pediatrician who works in KK Women's and Children's Hospital, and I mainly do pediatric dermatology. And I'm also a proud mother of two girls. So, what congenital ichthyosis mean is congenital means they are born with it. They carry the genetic mutation in their body that results in ichthyosis, which is very dry, scaly, fish-like scales on the skin. There are many forms of ichthyosis, though, for congenital ichthyosis. They can be mild with just a fish scale, scaly, dry skin on the legs, for example, or they can be as severe as the entire skin of the baby being affected. They are very red and eroded and raw from birth. These babies have problems with temperature maintenance. Some babies with a more severe form can be harlequin babies, where they're born with very thick, crusted shield-like plates on their body, their face, and that could cause problems with eye closing that can even impede their breathing as they expand their lungs. Very often, though, congenital ichthyosis can have babies who are born with normal looking skin and over months to years develop these red skin, scaly, dry skin. In some forms, we call it syndromic ichthyosis. They can have other system organs that are affected, such as eyes, ears, like hearing problems, heart problems, immune system. They can have severe allergies that make them more prone to infections. So it really depends. The extent of congenital ichthyosis can be from the mild form to the very severe life-threatening forms. Yes. So extreme temperatures can have problems for patients with chronic skin problems, especially ichthyosis. Because ichthyosis alone, we know it's the problem is with the skin formation. It's either too rapid skin cell formation resulting in this thick, scaly skin, or normal skin cell production, but they share at a very slow rate, also resulting in these thick scales. So most, if not all of these children actually have problems sweating. And hence, sweat is important to maintain your core temperature. So they actually can result in overheating very quickly. They get fever or heat stroke sometimes if you're not careful. So they can, if in under the hot weather, in a hot sun, if they're not careful, they don't hydrate enough, they don't sweat well, they can go into very high temperatures and the complications of it. So in very cold temperatures, they also may not be able to retain temperatures or maintain their core temperature so well. So the temperatures tend to fall very quickly as well. So I think they are very sensitive to temperature changes, and many of our patients, as they grow older, they will realize that. So they will have to self-regulate and remember to drink up, put sunblock to avoid being burnt also, because the sun has great effects on their skin. They can get sunburns, and that's not good for their skin. Okay, so I think challenges are a few folds. Firstly is the medical part, the skin part. They deal with itch, with pain. They have increased risk of infections that can put them back, meaning they lose opportunities. If they're in school, get infections, they may be hospitalized, so that would set them backwards as well. Whatever activities they choose, they have to be mindful of the skin, and that's why good hydration, understanding that they're heating up very quickly and taking breaks are important. So that's skin wise, and they also have to go for regular doctor's appointment to have their skin checked. They have to regularly moisturize their skin so that they don't get too dry and start cracking. They also have to make sure that their skin is well protected from sun, so sun protection is important. The other part is the social part. Skin is the largest organ on our body. So when you have a skin issue that is so obvious, people who may not know about the condition may look at you with a different sort of look. As a person going out, you want to be treated normally, I'm sure. So having these special looks or funny looks can make the patient, the child, and their family a little bit uncomfortable, I believe. So I think education or social acceptance is important for these children. This whole social aspect of teaching them how to answer starts from young, when they see parents answer questions, and then emulating that behavior, and also with some training as they start to grow up to teach them how to answer questions about the condition or explain to people about the condition. the skin being so affected can very often, affect the confidence, the self-esteem of an individual. So I think this confidence building has to be built from young, and parents and family, doctors, healthcare professionals play a big role in these children's self-esteem as they grow up. Very often it is a difficult news, it's a bad news to break to family members once a child is diagnosed. So most of the congenital ichthyosis are diagnosed at a very early age, either in early infancy or in the first few years of life. So breaking bad news, just like breaking bad news of any other chronic diseases or life-threatening diseases, it is always very sad, very shocking for parents and their loved ones. For a doctor, it's hard, but we still have to break it to them. It takes a while for them to accept. Different parents have different reactions. Some who are very calm will be very quick to process, and they just want to move on to what happens next, what we're going to do next, what should we do to help the child. So for the quicker parents who accept it very quickly and just want to move on to find solutions, we will take it along with them. But there are some parents who may take a little while. There will be a lot of guilt. Was there anything they did during pregnancy that had resulted in this? There's a lot of denial, meaning I was hoping for a perfect, healthy child, hoping this is false. It's going to take a few months and baby is going to become normal. We've had such parents. So for such parents, it's difficult because they don't want to go on to get the correct diagnosis. They say, no, let's wait for a while because it will go away. So we cannot push them. We just got to keep giving them the information and be ready to discuss and rediscuss and support them. Then there's the third group of parents who are in the center, in between. Like as much as they want to move on, they're also in a bit of denial, a lot of guilt. So they have the result, but they have a lot of what ifs. Maybe this is not, maybe this is wrong. They get angry sometimes at the situation, but it manifests as anger towards the medical fraternity when they keep bringing the child in for treatment or the child gets admitted for certain complications. So we just got to understand, have empathy, and support them. Most often than not, so far, all the parents will eventually move on this grieving process and come to acceptance, though the rate is different. And after they accept, then we can do our work with them and for the child to get better, to live life to the fullest, basically. Okay, the main challenge, I think, for my era as a consultant is a lot of information being easily available to non-medical parents, families, and patients. So Dr. Google, and lots of motherhood forums, as much as they're supportive, can sometimes lead to over-information and occasionally misinformation. So when they come into clinic for a certain problem and we make the diagnosis and then we propose a treatment, some parents who did their background research and reading, although the sources may not be verified sources or legit medical journals, they tend to have a misconception of the problem and the treatment. So it becomes difficult for them to comply to the treatment that you give because of their background belief based on their own research. So I sometimes see myself spending double the time trying to unteach them the information they learn by reading too much online, and then teaching them the correct medically proven therapy and treatment. So it takes a lot more patience and time. And sometimes also from a lot of information online, they get scared or very anxious. And many times it may not be necessary because the information may not be curated. So they can talk about complications A to Z, but the probability of the very severe life-threatening complications are actually very, very low. I always advise my parents for certain diagnosis not to overread too much. I'll give them the information leaflet that we curate and we write for the main purpose of the fact that I don't want them to be overly anxious by reading too much and the surrounding super rare complications that can occur around that condition. Yeah, so I think this is the main challenge in this day and age for us doctors now. Actually, this is a very hard question because every single day, and it is true, there's something that inspires me. But to pull up maybe one that can come to my mind would be a person or a young child who was diagnosed with a life-threatening condition and ended up in the hospital for very many months. The parents remain very calm and patient. They read on so much information, patiently discuss with the doctors because the patient's condition is so um, complicated that there were more than 5 teams of subspecialties of managing this child. So the parents really exhibited lots of patience, cooperation, understanding, and love for the patient and love for the people taking care of their child. Eventually, the child passed on, and now these parents are happy parents of a newborn child, 1 month old. Through the whole ordeal for them, it showed me, even after the child passed away and the medical doctors and nurses attended the child's wake, it was like a small party. The parents had finished grieving and was sending the child in that last part of the journey. There were balloons, there were videos of the little baby growing up. So that it reminds me that, as a doctor, we sometimes cure, often relieve the symptoms of the disease, but we can always comfort. So from these parents and many others, they showed strength, courage, and love for humanity. And that really reminds me of why I'm in this profession and how privileged I am in being able to help them and learn from them at the same time. Yeah. I decided to be a doctor in JC too. That was after a very good friend of mine passed away from brain cancer. So in JC1, he was diagnosed with brain tumor and went for 3 surgeries, brain surgeries, chemo, radio, and through the time we visited him, he'll always be so thankful. He lost his vision, this and that. But he will say that he's so appreciative. He had 17 years of good life. He saw other children receiving chemo, 2 years old, 1 year old, who never got a chance to really live. So he'll write like poems and all, and tells how thankful he is with the medical team because like they would support him and his father and things like that. Although he probably may not recover, but the comfort that they got throughout and the support was immense for him. And so eventually he passed away. It was JC2, maybe first quarter. So I thought I must get into medical school. Actually, I wanted to do pediatric oncology, like cancer and all, because I really feel for it. So, but when I went to pediatrics residency, I cannot, I'm too emotional, when I deal with oncology, because although the survival is quite high compared to adults, but ICU and oncology have a lot of high mortality. Like sometimes 1 week I can see 4 deaths, sometimes young babies and all. And then I cannot really function very well. After that, it takes a while. Yeah. So then I went on to finish my pediatrics and I chose peds derm because although a lot of peds derm diseases don't kill you, but like severe eczemas, they don't kill you, but they kill your soul. Like these poor children don't live to the fullest. They're alive, they don't die from it. They itch so badly, they scratch, it's so painful, they can't sleep for months to years. It's actually very poor thing. So I had eczema when I was young, so that's why I decided to go into this field to help them live better. She was a Harlequin baby. She's a very severe form of ARCI, one of the subtypes. And because of the thick shield, like she actually lost her all 10 fingers from birth. Like in the first week of life, because the skin is so tight, the blood supply to the fingertips was stopped. So there was auto amputation. So she lost all 10 digits within the first week of life.
Oh
So now
no.
she's about 5. She has no fingers, she has a stump. We
Okay.
feel sad, but actually the child doesn't feel sad. She's so loved. You can see the excitement from her face, the curiosity from her eyes. We feel sad when we hear that because we think like normal life should be 10 fingers and 10 toes, but because they are so grateful, people like them and their families count their blessings every single day, matters to them, that you don't see that sad part when you interact with them. You actually see a lot of strength and courage. So that's what's quite nice when you see these patients growing up.